Welcome back to Body Beautiful. We're talking about prepping for the summer with Dr. Elizabeth Lee. And first, let me remind you that we'll be taking your calls live on the air with any questions you have for the doctor. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you certainly want to consult your own physician. We were talking a little bit about photofacials, and we just glazed over all that.
Photofacials are fabulous. You know, because it's done quickly. It's relatively painless. I mean, people are nervous when we have it done, but it really just kind of feels like a rubber band snapping. And there's no downtime. You know, it's not a procedure where you get blistering or peeling of your skin. So you can have it done, and within 5 days, you will see a visible improvement in your skin.
I have a friend in LA. She's in the television business who swears by it.
I think they're great.
So what is it? The primary purpose is just to get rid of all those little imperfections that you have to put the cover cream on to make it look like you have flawless skin.
The primary purpose of a photofacial is to treat both the redness that could be associated with rosacea as a diagnosis, but also with tiny little broken capillaries that are part of sun damage and heredity, and those brown pigment spots, you know, that we get that persist as we get older.
Well, they persist as you get older, but also if you're pregnant or if you're taking birth control pills, they really start to take off.
There is a hormonal component in some patients, and that's called more specifically melasma, and it tends to be deeper pigmentation.
Okay. And they have the
hydroquinone, which works, and it's a chemical treatment, and certainly the photofacial will make your skin look a lot better. It doesn't do anything for wrinkles.
But it doesn't tighten as it goes along?
No, but with the same machine, using different light filters, we can do this skin tight, like we were talking about before, so that we can tighten skin. But, you know, in my mind, photofacial doesn't replace what I've always done with Obagi, which also can treat pre-malignant lesions, you know, and make the skin way healthier.
And that's a really important topic because, you know, pre-malignant lesions, you're saying too much exposure to the sun. Can you roll back the clock on that? Can you correct?
There actually have been some studies that have shown that retin A, which is one of the active components in Obagi, can decrease the findings of pre-malignancy. It won't treat cancer.
And what about vitamin C serum?
And vitamin C is a great product for protection. It is not something that reverses its sun damage, but it does work as an antioxidant to scavenge some of the things that go on in the skin when you get direct sunlight.
Okay, you're a wealth of information. Let's go to the phone lines. Rose from San Francisco, do you have a question for the doctor?
Yes. Hi, Dr. Lee. I was wondering, when I put on an evening gown and I have all this bulging in the back in my back, how do I get rid of that?
This area here.
So bulging, you know,
we all hate that.
That is best treated, like I said, by liposuction, and it is something that can be done. You know, when I evaluate you in the office, we talk about what the options are, but that's a very common area to treat with liposuction.
So unless you're at the gym bench pressing 200 pounds every day, I mean,
even if you're at the gym bench pressing, you know, sometimes as we age, we just hold on to fat in certain areas, and so, you know, you get rolls. Hey, you get rolls, trust me, I know.
So in that area, you could lipo that away?
Are you talking about the upper arm?
I think she was referring to this.
Okay, I think she's probably talking about the back. The upper arm is a little bit harder to treat with liposuction. It's an area that doesn't contract, the skin doesn't contract well. But again, if patients are counseled appropriately and are told what to expect, and if a physician's willing to say, you know, I know you'd like this done, but I don't think this is the best thing for you, then it can be appropriately used.
Okay. I want to get back to, you know, the photofacials. I mean, something that is new,
relatively,
and then, but also the same machine, you can modify it to do skin tightening as you go along?
This is the Cyton BBL, which is the machine that I'm working with in the office. So that, we can treat with this machine. We can treat pigment. We can treat red, we can treat small blood vessels, we can treat acne also. I've just started working with it, and when they initially told me, I was like, yeah, no way. It's actually working, and we're able to, I'm not sure how long it works. It may need touch-ups every now and then, but I've started working with it, and I'm getting great results.
All right, all steps towards naked skin.
Naked skin.
That's the objective,
yes.
I guess. Huh? Need to take a quick break. For more information about Dr. Lee, you can call her at 510-704-2170 or visit her on the web at artfulsurgery.com. When we come back on Body Beautiful, we'll continue our chat with the doctor, and we'll take some of your phone calls.